Good afternoon. I'm glad everybody's here today. It's been kind of a busy week to say the least. So we're kind of finishing up with this press conference today. The conference itself, or the briefing, is going to be on the Office of Childhood. And there's going to be some people here making comments, and really want to kind of make that the focus. But I know there's going to be some questions afterwards, so I'm going to try to address a few things early on in the conference. And one, I want to start off a little bit by some of the misinformation that's been out there that has to do with the CDC data that was posted and how that was reported across the state, and why I think it's really important that people understand how important Missouri data is and not to rely on other resources. So the one thing I would like to say with that, during the COVID-19, the way we've been able to issue data every day, number one, the data changes every day within this. So what you see yesterday is going to be totally different from today. And when you've seen kind of what happened with the CDC, and they said we were 50th in the United States, is totally misleading to the people of this state. So the reports that were made of that really needs to go back and let people know that that is not accurate where we stand. I talked to the White House this week, was on a call with them, their administration. They know that that's not accurate. They were going to make adjustments with the CDC. But it also affected a lot of other governors across the country, the way they were reporting. So again, I think it's very important for the media that are here today to make sure that you pull the data from the state, because that is the most updated data. You could literally take on any given day, if you use one metric, you could either write a positive story or a negative story, whichever you choose to write. And as you can see, a lot of it has been, a lot of the reports out there was totally biased and really just politically oriented of what it was. So I want to make sure I'm clear on that. I do want to touch on the Walgreens, the CVS situation, so everybody understands that's watching today. Number one, that is a federal program that the federal government offered for us to sign up early on. What happened there is the Walgreens and CVS, not just here in Missouri, across the country, probably overestimated what they could actually deliver. But again, that was under a federal contract, so that federal contract goes into our data on that situation. So we did get permission this week to take some of the doses, whatever amount we felt deemed necessary, to take that doses back, put it in our system, back into Missouri's control, where we could put it out to the healthcare facilities across the state. Walgreens and CVS will still be vaccinating our long-term care facilities, and they are doing that as we proceed. It was just an overestimate of what they did on that. I think the other thing that's important to mention, what we're dealing with, and we've been dealing with from day one, and we're going to continue to do that, is the supply is not going to meet the demand. And that's going to continue to be that way for some time. It's why we have to be disciplined. We have to stay focused on the groups and the plan we have in place, and to be able to do that. So I think that's important to know too, that we got to stay that. The mass vaccinations that we're starting across the state, and you're going to see the National Guard. The Guard will have 9 different locations the next couple of days around the state. Once that vaccine comes in more, as time goes by, we can expand those mass vaccinations to whatever that limit would be, which we could do 40, 50 sites in one day if we get the vaccine to be able to do that. So the National Guard is ready to support in a supportive role of the healthcare systems across the state. I do also want to mention yesterday, again, a lot of information was put out that wasn't very accurate, and unfortunately it dealt with the legislators putting some of this information out that was basically untrue. But number one, everybody in this building knows what the guidelines are to get a vaccine. If you got a vaccine yesterday and you don't have underlying health conditions and you're under 65 years old and you used your position to be able to get a vaccine, is totally uncalled for. And for the minority leader to come out and say there was confusion about it to try to cover up why they all run over there and got a vaccine is totally inappropriate. Everybody in this building knows what the guidelines are. And legislatures, by all means, should not be able to jump to the front of the line. And for the people that were in line, 65-year-olds, the people that qualify for that shots, definitely deserve better than that from elected officials here in this state. Everybody is going to stay under the guidelines that we have that we've established, and we're going to continue to do that. So I want to make sure that's very clear. There's a lot of misinformation there, but really what happened is people just went over there and they tried to use their positions to jump the line. It was the simple truth of what happened yesterday. So let me go to today's, where we're talking to the Childhood Press Conference. With that, I want to focus on why we're here today. As you know, yesterday I announced the new Office of Childhood in the State Address. I have said many times that our children are the workforce of tomorrow, and if we are truly to make a difference in their lives, it starts with early childhood development. Throughout our administration, we have visited many child care centers across the state and received valuable feedback from child care providers, educators, families, child advocates, and state government leaders. It became clear that our current approach is fragmented across multiple agencies and must be addressed. Currently, Missouri has several early childhood programs housed across the Department of Elementary and Secondary Education, the Department of Health and Senior Services, and the Department of Social Services. Programs related to child care, home visiting, early learning, and early intervention will transition into one office to be housed under DESE. This consolidation will provide a more comprehensive and streamlined approach to early childhood development in the state of Missouri. This new office will also provide all Missouri children and families with better, more consistent access to quality programs and services. One of the things I want to stress since I've become governor, I've been to so many different areas of the state of Missouri, and the one thing I am totally convinced of, if we truly do the same old thing we've been doing for decades and decades with our children, nothing's going to change. You're going to have the same problems we have today, you're going to have it another decade from now. We truly have to make a difference in the quality of life that we get our kids. We got to find ways to get them in a classroom. You got to find ways they get educated and they have the ability to go out and get a job. That should be a priority. That affects the crime rate, that affects the health system, and it affects the future of our state. Those things are important, and we get it right. And we need to cut the bureaucracy out and get the main sources, the resources we have, to the children of this state. So today, I'm happy to have each of these agency leaders here to talk more about what that consolidation means for their departments. And first of all, the Acting Director, Jennifer Tidball, is here, and I'm going to let her come up and say a few words. Jennifer?
Thank you, Governor. Good afternoon. Safe and stable and nurturing environments are essential to prevent child abuse and neglect in the early years of a child's life. Feeling safe allows young children to build strong relationships, be confident, and reach their full potential. The Child Care Subsidy Program supports low-income families who are working or in a training or education program. Just like any parent, these families want safe, quality options for their children so that they can be productive Missouri citizens. The Office of Childhood provides a great opportunity for child care subsidy eligible families and child care providers accepting subsidy to gain additional instructional support and access to care. As the Child Welfare Agency, we want every Missouri child to have an opportunity for a safe, nurturing place to learn. I am confident that the Office of Childhood puts Missouri on this pathway. The Department of Social Services will continue to support the Office of Childhood in any way we can, and we, the Department of Social Services, will continue to determine eligibility for child care subsidy after the transition. Thank you.
Thank you, Jennifer. Next up is Dr. Williams.
Thank you, Governor. There's something to be said for experience. And so I'm just incredibly thankful. The governor has served many years in different capacities and seen the issues that affect Missouri from many different lenses, whether it be a sheriff or in the legislature, lieutenant governor or governor. So I'm just incredibly excited and feel privileged actually to be part of this initiative around childhood, integrating all our efforts and aligning all our efforts around early childhood development and wellness is what we would call it in medicine. I was an obstetrician for a long time, delivered a lot of babies. And so as those babies grew up and I took care of the families. I had 3,000 patients. I could kind of watch and observe. And so I just think this is an incredibly exciting initiative for Missouri, and especially for the health of our families and for the health of the children themselves. So thank you.
Thank you, Dr. Williams. Next, Commissioner Van Dieven's going to come up. Before she comes up, I want to give a special thanks to a lot of her members in DESA yesterday that had to do a lot of different maneuvering around the state capitol to make the State of the State happen yesterday. I want to give all of them a big thank you for what they done yesterday. It took a lot of IT work, a lot of things to switch the State of the State speech yesterday, and they were played a big role in that, and I want to thank them for that. So, Margie?
Thank you, Governor. First and foremost, I want to say how honored our team at the Department of Elementary and Secondary Education is to house and lead this new Office of Childhood and the important work that it encompasses. Thank you to Directors Tidball and Williams and their agencies for the continued support, and thanks to Governor Parson and his team for their commitment to our children. Early childhood has been a long-standing priority for the State Board of Education. And I want to be clear in telling our early childhood stakeholders and Missouri families across the state that this office will continue to focus on all three of these priorities and perspectives: safety, health, and education, and truly focus on the whole child. We want children to be successful learners, and to do that, we know they must first feel safe and be healthy. Research tells us that children who lack these basic needs come to school with cognitive and social emotional deficits that our educational system cannot remediate on its own. Once children are safe and healthy, they then need access to high-quality early learning opportunities in every part of our state, with our early childhood professionals who have access to quality training and are informed of best practices so that they can be as effective as possible, all while working towards the same goal of school and life readiness. We will also remain committed to supporting Missouri families. There is no greater gift and no greater responsibility than that of parenting. A parent's first priority is ensuring the safety and well-being of their child, and we believe parents are their children's first teachers. And we have all heard from that nervous new parent who wants to do this well. Providing parent education is an important tool in helping children be safe and healthy and grow into successful learners. Teaching parents to recognize what to expect in their child's development, the value of regular developmental screenings to gauge their child's progress, and to know when it's time to ask for help for themselves as parents or for their children is key. Maintaining and strengthening the public and private partnerships that serve Missouri children must be a priority. This office will continue to recognize and promote the importance of these partnerships. When school and community programs come together to serve families and educate children across our state, working towards the same goal at the state and local levels, we can truly make a difference in these formative years of a child's life. The early years of a child's life are truly the foundation for lifelong learning. Research shows that nearly 90% of brain development occurs by age 5, and that while babies are born with the same brain cells as adults, it's the connections that brains make in those early years that lead to success later in life. We also know that children enrolled in high-quality early learning programs achieve greater success in school and have improved health and lower crime rates as adults. Now, I often talk about that strong finish that we hope to see from our students, where they graduate from high school fully prepared for post-secondary education or training, or the workforce, or military. And to achieve that strong finish, we must provide children with a strong start. Thank you.
The directors and commissioner will be back up here to answer questions. I just want to thank Jennifer and Dr. Williams and Margie for giving us an update. The leaders and their teams have truly stepped up and worked hard to make this happen. Our goal has to come together to best serve our children, our families, and our state, and that is exactly what they have done. Early childhood education delivers one of the greatest returns on investments of taxpayer dollars, and we are excited about the new Office of Childhood and will benefit Missourians for many years down the road, and we appreciate all that has taken to make this into one Office of Childhood. One other thing, I'm going to turn over for questions here just in a minute. Kelly, one thing I wanted to mention on that I forgot to earlier on the National Guard, the locations they'll be at this weekend. I'm sure, hopefully you've seen that by now, but if not, I will give you a real quick rundown of just the counties they'll be in. Starting in Region A is Pettis County, Region B is Randolph County, Region C is Lincoln County, Region D is Jasper and Newton County, Region E is Butler County, Region F is Adrain County, Region G is Howell County, Region H is Andrew County, and Region I is Pulaski County. All right, with that, Kelly, let's open it up for questions.
Commissioner Van Heaven? Any questions for the commission?
Great, thanks.
Acting Director Tidwell? Okay, good. David?
So under this transfer of power, social services is still overseeing the foster care system, right?
Yes, this is specifically related to the child care program. We will continue to oversee child welfare and foster care.
All right, thank you. Dr. Williams?
Hey, Emily.
Dr. Williams, have you heard of any places in the state of Missouri, other than we've heard Governor Parson say Walgreens and CVS, of healthcare systems possibly hoarding or keeping vaccines? Is there any sort of extra vaccines at any of the facilities around the state? And if so, where are they?
Yeah, Emily, thanks for the question. We talked a little bit about this yesterday. I don't know of any facilities that are hoarding. However, we watch it daily, and Robert Nodell watches that incredibly closely. So when we see, especially in the large healthcare systems, because they get very much large amounts of vaccine, when we see a little bit of a discrepancy, if they have 10,000, they've administered 5,000, where are the other 5,000? We call them, and we say, you know, help us out here. And Robert really leads those efforts, and Robert will call them, and they'll say, yeah, we just haven't reported the 3,000, or we're doing 1,000 a day, and we're 5 days into it, which is perfectly reasonable. To do 1,000 a day is perfectly reasonable. But no, I do not believe that that is an issue here in Missouri of hoarding. But even having said that, we watch it like a hawk. Yes.
Hi, Dr. Williams. Quick question for you. I know the state has been keeping track of spoilage, if any of the vaccines have been wasted. Have any been wasted?
There is a very, very small amount. We had, I think, 2 issues where trays arrived that the temperature gauge had gone off, and so we called the company and they sent 2 more. So that's why we have those temperature gauges, just to make sure nothing's going on there. And it's not unheard of that if you've got, 10 doses or 5 doses to a vial or 6 doses now with the Pfizer, that you give the 5 and somebody doesn't show up, and so then you can't use that because you've already used it. But those are minuscule. I mean, it's a very, very, very small amount. I'm not going to say it never happens, but it's small.
And then how's the distribution going to getting these vaccines to rural, smaller healthcare communities?
Yeah, again, I think that's where we are now, and the governor has made that very, very purposeful, that just because it's hard or challenging doesn't mean we don't do it. And so,
you know, when you look at where these mass vaccinations are occurring with the National Guard, you can see a pattern there. They may not have as many Walgreens and CVS's, and the health departments there may not be as robust. So when we send in the National Guard, and we learned this with testing, I don't know if you ever got a chance to go, I see a testing site from the National Guard, but it's just incredible. I mean, the people drive up in their cars, they get tested, they drive off in 7 minutes. And so we learned that, we kind of built that muscle, if you would, that public health muscle during the testing. And so now, if you watch the Guard, you'll see kind of a pattern that they're very much going in those areas, because the governor knows from experience, whether it's flooding or what we learned in testing, they're a huge force multiplier to get into those areas that might not be served as well as a St. Louis or a Kansas City. You're welcome.
Just one more quick question, Dr. Williams.
Okay, Emily.
Have we had any other of the variants here in Missouri? I know you said you were testing them.
Yep.
I didn't know if you've seen anything or if you've heard anything.
Checked this morning about 11 o'clock, Emily, and we have not. You've heard on the national news that the South African variant has been identified in South Carolina, so that's concerning to us. And I'm very excited to report that very shortly our lab will be able to do the entire gene sequencing as we look for these variants. We look every day at 500 samples, all of them, to make sure it's not popping up here in Missouri, because it is in the Midwest. To date, we have not seen that, but we're going to further build out our capacity next week to be able to do all that in-house. So thank you. Thank you, Kevin. Hey, David.
When do you anticipate reaching that tier that would provide the vaccine to school teachers?
Yeah.
Who aren't over 65, just rank and file.
Dave, thanks for your point. Obviously, in any category now, if you're over 65 or you have a comorbidity, like the governor said, you're eligible right now. But as a category 1C, you know, it's a little hard to give you an exact timetable, because right now at 84,000 a week in a universe of 3 million, that would take time. But you know, we fully expect J&J to submit an EUA next week, and they've promised 1 million doses by July. AstraZeneca has been approved in the UK, so we think they'll come on board in March. So if you know, in kind of best case scenario, if we have 4 vaccines in Missouri in March, and we've kind of moved through, one would hope, you know, in this spring, maybe early spring, that we would get to that. I know Margie's listening to every word I say here, but that would certainly be our hope that we will do that. I always want to say everything based on what we know now, as of today, because as the governor says, it's really dynamic. But we are hopeful that would occur in April. Okay, thank y'all.
Governor Parson?
Questions. Hi, Governor. So Walgreens said it had leftover vaccines because facilities overestimated how many people actually wanted the vaccine. Now, are you worried at all about the vaccine hesitancy, especially within that age group?
No, I think we can still handle that fine. What I think the way they come up with those numbers is they counted beds instead of patients, was one of the theories they used in coming up with the vaccine in that industry. The other thing is I think everybody estimated, keep in mind this is when we first started, that they thought probably more of the healthcare industry would take the vaccine also. So there's a lot of combinations why there was extra. But as far as the people in the homes, they're getting vaccinated at a rate that they should. You know, so we're pretty comfortable with that.
Okay, another question I had was, you mentioned that there's a political rhetoric against CDC's data, yet at the top of their list shows Alaska and West Virginia, who have Republican governors. Can you explain that?
No, I mean, I don't have any idea of why that. I'm just telling you what happened in Missouri, and it was totally inaccurate to kind of report us as last when that wasn't what the data really was, and it wasn't up-to-date data. So again, if you take Missouri's data, for example, and we're 3 days behind other states for whatever reason because it wasn't reported, then it's totally unfair playing field when you try to compare us with other states. That's why you have to just not be able to go take one metric and do that. Again, you can write whatever story you want that way, but what happened, it was for political use and bias, the way it was reported, really just trying to put fear in Missouri people and trying to make it look like the administration was doing a bad job, and that's not true at all. And I think it's going to prove out. We've took a balanced approach for this from day one. And if you really analyze where we're at in the United States and all the states around us, we're much better off. And we've been very fortunate. We've been in the eye of the storm for months. And, you know, I'm thankful where we're at compared to other states around me.
Thank you.
All right. All right, thanks everybody for being here. Thanks.